We first have to start with the numbers, because the numbers are absolutely staggering. Doctors were responsible, and healthcare professionals were responsible for between 150 and 200,000 deaths during the time of the Nazi regime, and that's from the barbaric medical experimentation and research that went on, from starvation of people deemed unfit, and of course from the euthanasia programs that were prevalent during that time. If the work of the Nazi physicians hadn't been done, they would have never even been able to get to kill 6 million Jewish persons and the 9 million other persons that were murdered in the Holocaust. So the numbers are very important to think about. The way in which the Nazis did that was to pick populations that they knew people felt were disposable, disabled children, disabled or mentally ill adults, then to look to people like the Jews who had already been marginalized, and people like the Roma people, the people that no one cared about. It made the physicians feel that they were doing a service to the state, and it put them in a better light in the minds of a lot of people. So now imagine yourself as a medical student in Germany in the early 1930s. Everything you see in the culture is anti-Semitic propaganda, is otherizing people with disabilities and placing stigma on people that are not racially pure. And then you go to medical school and you're sitting in a lecture hall with one of the top scientists or physicians in the entire world. And they are telling you that they have scientific proof that certain races are superior to other races. Now, what are you going to do? Who are you to question that, and would you have the courage? You might feel something like, this is not right, this does not comport with my religious beliefs, but are you going to have the courage and the strong conscience enough to not participate, to be able to say no to that? And not only that, when you get out of that classroom and you walk around, you look around, guess what? All your Jewish colleagues, they're not even in medical school anymore. The Jewish professors that used to teach at your university, they're not there anymore. And so this further isolation and stigma in the culture certainly influenced the way physicians thought about what the purpose of medicine is, and that can't be understated. Now, think about it from the other perspective. Physicians influenced culture, and the Nazis knew this. They knew the power and privilege that physicians had in society, and they utilized that. To paraphrase one of the Nazi administrators, he said, the role of the physician should be one of racial leadership, because they knew that if they could get the physicians in their corner, they would be able to use that power for their ends. And they had a very brilliant way of doing this. They created not just a simile, but a very powerful metaphor that Germany is a body. Germany is a body, and the body is sick, and it is weakening. And guess what? The disease, Jews are the disease. The Roma people are the disease. People of color are the disease. Homosexuals are the disease. So now, what do you do when a disease is afflicting the body? You isolate it, you try to contain it, you suppress it, and if you can't do any of those things, what do? You cut it out. You kill it. Now, this is a powerful metaphor that even a lay person can understand, and now in comes the physician. So now, what better way to rid the German body of disease than by bringing in the physician who is trained to rid your body of disease? It was a natural fit with their metaphor, and it was very powerful.